So this is your right lung and your left lung. The top points are the apex. The bottom is the base, but only down here, like if he pins this muscle, this would be diaphragm. The right lung is bigger. Why?
3 lobes.
3 lobes. Why does it have 3 lobes? Why is it bigger?
Because you got the heart on the side.
Heart's on the left side. Good. So your 3 lobes are superior lobe, middle lobe, inferior lobe. So because there's 3 lobes, there's 2 fissures. This is your horizontal fissure. What's another name for horizontal?
Transverse.
Transverse fissure. Good. And this is your oblique fissure. Oblique or right oblique. I don't think you would do that. On your left lung, you have the superior and inferior lobe with what fissure? Oblique fissure. Good. Okay, so we're done with that, right? We take break it apart. The left lung has a cardiac impression, the space where your heart sits in. We have cardiac notch. Some show it better than others. And this is lingula. Some show it better than others again. Know that this is your esophagus. This is what? Descending aorta. Good. This is your trachea. The part where it splits is called carina. I think this is on your PowerPoints, not on your syllabus, so carina. And then it goes into the right and left side. Primary bronchi, or bronchus for singular, primary bronchus. Then it splits to secondary, and all the little splits are tertiary bronchi. Same with this, primary, secondary, and then all the little ones are tertiary bronchi. Anything that's the pulmonary artery and veins, they're going to be the only opposite ones, so in color. This blue one is going to be a pulmonary artery, and this red one, these red ones are going to be pulmonary veins. So why are they switched?
Because they're being oxygenated?
Yeah, because the veins are coming back oxygenated, the arteries are going towards the lungs to get oxygenated. Heart. Okay. For the heart, you know this, we have the superior vena cava, we have the left and right brachiocephalic veins, we have left and right subclavian vein, left and right internal jugular veins. We have ascending aorta, arch of aorta, descending aorta, brachiocephalic trunk. I guess this would be it too. This is common carotid, subclavian, common carotid, subclavian. This, it's oxygenated, it's deoxygenated, so it's blue, but it's an artery because it's going away. It's a pulmonary artery. The first part would be pulmonary trunk. This is going to be your left and right pulmonary arteries. The part covering the atria are called auricles. They're just the flappy coverings. Teach outside. Coming off of the ascending aorta, we have the right coronary artery, the marginal artery, posterior interventricular artery on the back. Posterior.
These are the blue ones, right?
The arteries. Okay, so these arteries and veins are going to be the same color, red, just like this. It's coming off here. So oxygenated, red. Okay, so this red artery is right coronary artery, right marginal artery, and this is posterior interventricular artery. Underneath the auricle, some hearts you can see it, you have left coronary, so if he wants to know what comes first, left coronary. This one going straight down is anterior interventricular artery with a branch coming off of it, diagonal branch. Anterior interventricular artery can also be called the left anterior descending. Coming from the left side, it's anterior on the front and it's going down. So left anterior descending artery. The one going all the way around is circumflex artery. That's all you have to know for the arteries. Then we go to the veins, the blue here. They're all going to drain into the right atrium. And all the veins will meet up to this coronary sinus. So we have 3 veins that we should know. From the right side, we have this vein. This is small cardiac vein. From the left side all the way down the front, we have great cardiac vein. And down the middle, we have middle cardiac vein. So middle cardiac vein, small cardiac, and great cardiac vein, all joined together to form coronary sinus, and they drain into here. Opening for the coronary sinus. Here. We also have an opening here for superior vena cava, opening for the inferior vena cava. Sometimes he does that. Interatrial septum is the wall between the atria. This is a fossa. It's called fossa ovale. In fetal life, it's a foramen. What's that? Foramen ovale. Function is important for that. It goes through a valve. It has 3 cusps, so it's tricuspid valve. All the cords are chordae tendineae. And that muscle down there is papillary muscle. We can see it better on other hearts. Papillary muscle. All the rough stuff in here, trabeculae carnae. This is myocardium, the thick muscle of the heart. Once it goes into the right ventricle, it's going to go to the lungs. It's still deoxygenated, right? So it's going to go to the lungs and has to go through the pulmonary arteries, through the pulmonary semilunar valve. So it goes to the lungs, gets its oxygen, and comes back through pulmonary veins. So we have superior on the top, inferior on the bottom, pulmonary veins, into the left atrium. Then it goes through the bicuspid valve. You try before you buy. So bicuspid valve or mitral valve. And again, the white cords are chordae tendineae. Here we have our papillary muscle that they attach to. This shows a good papillary muscle. And again, trabeculae carnae is all the rough stuff. The wall between the ventricles is interventricular septum. So once it's in the left ventricle, it's going to leave through the aortic semilunar valve and enter the aorta. These go to the top of the body. This goes to the bottom of the body. I think that's all for the heart. Oh, thank you. Okay, this right here is ligamentum arteriosum. In fetal life, it's called ductus arteriosus. You know the function of that. You also have SA node, AV node, which it does't show it on here, so when we do the other heart, I'll show you there. Bundle of His goes down, and Purkinje fibers go up.